Hi, everyone. So today we're going to talk about our topic, which is a survey on alcohol consumption. And this is presented by Group 8, which consists of Monica, Trisella, Shruti, Shivani, Sindhupriya, and Harshini. So firstly, coming to the topic selection, we selected this topic because consuming alcohol is very common in our generation, but it is also associated with the risk of developing health problems such as mental and behavioral disorders, including alcohol dependence. So we're very curious to know about the preferred alcoholic beverage in a population, their age group, employment, as well as their health status. So the first step was the data collection. We collected and created a survey with Google Forms with questions regarding the age, gender, alcohol consumption, preferred alcoholic beverage, the distance individuals were actually willing to travel to get the alcohol, and a couple more questions. Then everyone in our group shared the link to our family and friends, and then we collected their responses.
So I'm going to talk from now, like how we analyze the data, like after collecting the responses, we transfer the data from Google Forms to Excel and then perform the analysis and obtain the results for the questions which we are looking for and represented the data in various graphs. Uh, so the graphs are here. This is our dashboard. And when coming to the first graph, it represents the data collected from people of different age groups, ranging from 15 to 20 years and so on. The different colors represent whether they consume alcohol or not. So from this graph, both males and females of the age group 21 to 25 consume alcohol the most. And moving to the next one, it shows how far people are willing to travel to purchase alcohol. And it shows that many prefer traveling 1 to 3 miles. And then coming to the next one, it represents the reason for alcohol consumption among students, employers, and unemployers. So many students consume alcohol for social events, followed by family occasions, and very few consume alcohol for no reason, while the part-time employers, represented by the orange color, consume alcohol for social events and also for no reason. And moving to the next one, it represents the preferred alcoholic beverage among men and women and the place preferred by them to consume alcohol. It shows that men prefer beer and drinking outside, whereas women prefer drinking beer in the house. And the next one represents how many glasses do they consume, how many times do they consume alcohol. And the results show that most drink for 1 to 2 times a week and 0 to 1 glasses per consumption. And the last one shows how people rated their own health status and how many times they consume alcohol per week. So many people who consume alcohol for 1 to 2 times a week rated their health status as 5, and the one who drinks 7 times a week rated themselves as a 3. So these are all the findings. Yeah, as I said, those are the findings.
Yep. So next is according to the CDC article on alcohol and public health, excessive drinking was responsible for 1 in 10 deaths among working age adults, which are between the ages of 20 to 64 years. And then binge drinking is the most common form of excessive drinking and is defined as consuming 4 or more drinks during a single occasion for women or 5 or more drinks during a single occasion for men. So binge drinking is responsible for more than 40% of deaths in the US, and alcohol use has immediate effects that increase the risk for many more health conditions. So some of the short-term side effects includes injuries, violence, alcohol poisoning, miscarriage, and even stillbirths. But moreover, there are long-term side effects which include high blood pressure, heart disease, stroke, liver disease, and so on. So because of this, in conclusion, we can see that alcohol consumption has long-term side effects on health. So it is important to educate people about the ill effects of effective alcohol consumption through various preventive and treatment programs as well. Thank you.